Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A patient with a history of rapid cycling bipolar disorder presents for evaluation of her current profound depressive symptoms. The patient has been maintained for the last 2 years on valproic acid and quetiapine, but now a major depressive episode has occurred and the patient is reporting passive suicidal ideation. Concerned that the suicidal ideation may progress, the psychiatric mental health nurse practitioner considers which of the following pharmacotherapeutic options? A. Cariprazine, B. Lumateperone, C. Aripiprazole, or D. Lithium. And D is the correct answer to this question. Remember, lithium is the only medication from among those listed, and I won't say it is the only medication, but it certainly is, for all intents and purposes in this conversation, it's the only medication from among those listed that is both indicated for bipolar depression and correlated with a reduction in suicidal ideation. And that's the distinction here, obviously. A, Cariprazine, which is marketed as Vraylar, B, Lumateperone, which is marketed as Caplyta, and C, Aripiprazole, which is marketed as Abilify. They all have indications for bipolar disorder, and you could use any of them for bipolar depression, but lithium is the only one that is correlated with a decrease in suicidal ideation, independent of its efficacy on mood disorders. No one has really articulated how or why this happens, but there is a clear evidentiary foundation that lithium does correlate with a decrease in suicidal ideation and that the others don't. In fact, in all of psychiatry, there are only 2 medications that have a documented decrease in suicidal ideation, independent of their therapeutic effect. Lithium is one, and clozapine is the other one. And remember, clozapine is a second-generation antipsychotic marketed as Clozaril. It is a very effective antipsychotic, but it has a number of potential safety issues, and, well, of course, so does lithium. But Clozaril really is almost never a first-line go-to intervention, whereas lithium is the classic prototype mood stabilizer. That's what lithium is. And while we classically think of it as having its greatest utility in the patient with an acute manic episode, and it definitely does have that utility, lithium also can be used for maintaining stability to prevent cycling, and it also is used specifically for bipolar depression. Remember, lithium comes with some potential safety issues. Lithium requires regular monitoring. It requires a patient who can be adherent to the monitoring schedule, be aware of early indicators of toxicity. The more effective a medication is, always the more concerning the potential adverse effects are. So lithium does have its issues, but it is a great drug, and it is indicated for bipolar depression. And again, it is one of only 2 medications in all of psychiatry, and the only one that is listed of your answer choices here that has a distinct and separate demonstrated reduction in suicidal ideation. So, because the question is asking you specifically, it says, concerned that the suicidal ideation may progress, the NP considers which of the following. Again, you could consider any of them for bipolar depression, but if you are concerned that the suicidal ideation may progress, the one on this list that stands out is, of course, lithium.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.